Hello everyone, welcome to Patho Excellence and welcome to this pathology practical session. Many students lose marks in gross specimen viva not because they don't know the diagnosis but because they do not follow a standard format and they do not reach to the diagnosis while describing the specimen. In pathology viva, examiners expect a systemic, structured and professional approach starting from the very first sentence. So in this video, I will explain why a standard format is required to describe gross specimens, how it helps you avoid common mistakes and how it improves your confidence and scoring in the exam. This approach is applicable to all gross specimen and is especially useful for second MBBS internal as well as external examinations. So let's begin. Why standard format is required in gross specimen viva? It ensures systemic and complete description. It creates a professional and confident impression. It prevents common viva mistakes like you directly tell diagnosis first without describing the specimen or use improper terms to describe the specimen. It helps students score maximum marks, which is the most requirement. It reduces viva anxiety and examiner interruptions. It applicable for all gross pathology specimens and it matches examiner expectations and marking scheme. So, it is important that knowledge without format leads to loss of marks in viva. Now, there are some golden rules which if you follow, you will get a maximum marks. First of all, gross specimens are for practical table and slides are for microscopy. So do not interchange terms when you describe slide or gross specimen because it is important that you use correct terminology. So first rule is listen first, speak second. Means always listen carefully to the examiner's instructions and follow their instructions exactly before you start answering. Suppose examiner asks you to describe any one specimen, then you choose uh, the specimen you know very well among the all specimens which are present on the table, or examiners ask you to tell directly the diagnosis of particular 5 specimens, then you follow his or her instructions. Or if examiner says that you give me 5 your choice gross specimen description, then you accordingly answer the examiners questions. So listen first and speak second. Second is always look at the specimen from all sides and mention the size in centimeters in 2 or 3 dimensions. Like there are many specimens which are put on the practical table. When you are asked to describe specimen, first look at the specimen carefully from all sides. Do not turn or do not uh, what it can say, like do not turn it in a way that the formalin come out and it will spoil the your exam. So see all sides, measure properly, speak in centimeters. Means you have to describe the specimen size in centimeters. Never jump to diagnosis first. Unless and until you are asked to say diagnosis first, never jump to diagnosis. first because the description matters and your description uh, will have some marks in practical viva. Always move from general to specific and to diagnosis, means start from general features, then some specific features related to the diagnosis, and then the final diagnosis. And do not rush or panic, do not argue with examiner, do not over describe unnecessary details, and do not guess if unsure. But whenever you are unsure, describe whatever you can identify or what are the visible features that you can tell. Now let's start with step by step approach. So step 1 is identification. Whenever you see any specimen, try to identify which organ is this. Like if you identify this is the heart specimen, then it will be easier for you to describe the lesion, because in the heart there are few uh, diagnosis which can be asked in your exam. Like one is uh, myocardial infarction, healed MI or acute MI specimen, or hypertrophied heart or atrophied heart. So it will be easier for you to remember 3 to 4 diagnoses, and it will be easier to identify specimen during the exam. Now step 1 is identification. So always your first sentence must be this is a formalin fixed gross specimen. If you have a whole specimen like heart, so it's a formalin fixed gross specimen of whole heart or part of heart or slice of heart. So this must be your first line whenever you start your description. So remember, formalin fix word is important because in pathology museum we are using 10% formalin for fixation of any organ. So for example, here it is given this is a formalin fixed gross specimen of heart, or this is a formalin fixed gross specimen of appendix. Now at this step, do not say disease name here, and sentences which you should not use, like this specimen is in formalin, this organ is dipped in formalin, this is preserved organ, this sound casual and non-academic. So always use this sentence. Now step 2, size and shape. So mention if this specimen is normal or abnormal, and here you have to identify the specimen whether it is abnormal, enlarged, contracted, normal in size, and shape of the specimen oval, tubular, globular in shape according to the organ, right? So these are the some terminology you have to use when you describe the specimen. And most important is measurement. So measurement is you have to describe like it is measuring approximately 6 by 4 by 3 centimeter in size. So always describe length, width and thickness or diameter if tubule like structure is there. And for the shape, appendix is generally tubular structure, ovary it is oval to globular or cystic in nature. So this terminology we will learn organ specific terminology in our next video. So let's begin with the first 5-second rule in gross specimen viva. So ideal opening line, as we have discussed, this is a formalin fixed gross specimen of. So this will take 2 seconds time. So it gives impression of you are confident, you are correct and examiner approved. Now in next 3 seconds, if you are not stopped, the specimen is this by this in size and this in shape. So total will be 5 seconds. So here the example is this, like complete 5-second script is, this is a formalin fixed gross specimen of appendix. The specimen is enlarged. You can also tell size and diameter, and it is tubular. Now for example, heart, this is a formalin fixed gross specimen of whole heart. The specimen is normal to mildly enlarged, and you can add dimensions. Now step 3, external surface. So always describe color, surface and texture. So the external surface is smooth or rough or congested or dull or nodular according to the organ. You have to see the external surface and you have to use that terminology. And be specific. Don't use external surface a word in each and every organ, because if you are uh, describing heart, then external surface is pericardial surface. So always use word, like for specimen of myocardial infarction, use pericardial surface appears dull or shining, having uh, any hemorrhage or necrotic area, etc. Now for appendix, external or outer surface is serosal surface. So use word serosal surface is congested and covered with exudate, right? Now here we can see uh, this is the example where the jar containing specimen of mature cystic teratoma. How you will uh, describe external surface as well as cut surface. So here in this specimen, you can see this is a cystic structure already cut open. So you can say the cystic specimen is globular to ovoid in shape. The external surface is smooth and glistening, and here the wall appears thin and few surface nodules or excrescence are seen. So this is how you can describe external surface of this cystic ovary. Now you turn the specimen and you can describe cut surface whatever you see. So here in this, the cystic structure on cut section shows predominantly cystic area. Cyst cavity is containing thick yellowish or white greasy material which is sebaceous material, and these are the hair shaft which are floating within the cyst, and some solid protuberance or Rokitansky nodule may be projecting, and this cyst wall is thin and smooth. So this is how you can describe external as well as cut surface. So step 4, the cut surface, most important step that we have already discussed for teratoma. This carries maximum marks because cut surface shows the diagnostic uh, clue and diagnostic uh, part that leads to diagnosis. So here on cut section, the cut surface shows, so mention color, consistency, necrosis, hemorrhage, cavity, mass, etc. So like suppose a specimen of lipoma. So here it is yellow greasy lobulated cut surface. Renal cell carcinoma. So it is having golden yellow mass with areas of hemorrhage. So it is very important to see cut surface properly and describe its properly. Now step 5, characteristic gross features. So already you have seen cut surface properly. Now this step clinches diagnosis. So characteristic gross features noted is For example, like for myocardial infarction, if healed MI is there, so you will see either pale yellow or whitish infarct with hyperemic border. Tuberculous lymph node is there, you will see cheesy caseous material. Like leiomyoma is there, you can say the word world appearance. So this is the characteristic cross feature for any particular diagnosis. So last step is diagnosis. So concluding line is like always start with hence or this feature suggest, right? So hence the gross features are suggestive of, like you are not using directly or stamping the specimen as this is the specimen of acute myocardial infarction, but you have to use word suggest or suggestive of, like these features suggest myocardial infarction, or hence all these feature conclude that these are the feature that suggestive of myocardial infarction. So here the complete answer is for the appendix. If it is acute appendicitis, this is a formalin fix gross specimen of appendix measuring approximately this by this by this centimeter. This specimen is enlarged and tubular. The external serosal surface is congested, dull and covered with fibrinopurulent exudent. On cut section, the lumen is dilated and filled with pus and the wall is thickened and edematous. So these cross features are suggestive of acute appendicitis. So this answer will give you full marks. Now words that must not be used while you describe your gross specimen, like slide shows, because slide is always related to microscopy. Microscopically, these are the macroscopic description. So no, do not use word microscopically. HPE. So HPE is histopathological examination, that is a microscopic term, and cells are seen. Here you cannot identify any cell because this is a gross specimen and cells can only be identified under the microscope, or do not use word under microscope because these all terminologies are histology term and they are not used for gross pathology. So correct word to use instead are specimen shows on cut section or grossly, the cut surface reveals, and characteristic gross feature is. Right? Now, what are the common examiner traps? When you say diagnosis first, either you skip the cut surface description or you use wrong terminology in gross specimen description, or you say it looks like cancer. So these are not appropriate terminology and you will lose marks. So one line memory formula or Viva formula is, first of all identify organ, then size, then surface, cut surface, special features, and lastly the diagnosis. So these are the bold box rules you must follow in Viva. Rule number 1, always start with this is a formalin fixed gross specimen of. Rule number 2, never say slide, microscopy or HP in gross Viva. Rule number 3, speak only in this order: organ size, surface, cut surface, hallmark and diagnosis. Rule number 4, do not say diagnosis in the first sentence. Rule number 5, use words like grossly, specimen, cut section. Rule number 6, if confused, describe what you see, not what you think. And rule number 7, end confidently with, hence the gross features are suggestive of. So, universal Viva speaking template you must memorize. This is a formalin fixed gross specimen of. The specimen is this in size and in shape. External surface is this. On cut section, the cut surface shows the characteristic gross feature is, hence the gross features are suggestive of. So, if you follow this order, you will never fail gross specimen viva and you will get full marks. So, I hope you like this video and you follow this instruction and standard protocol to get full marks. And please like, share and subscribe this channel for more such videos. In next topic, we will describe specimen wise gross description and viva questions. So do not forget to subscribe this channel. Thank you.